going. So welcome everybody. This is our second episode of Mitigate Partners, Demystifying Healthcare Costs. So we've got some great tools we want to show you today, but as with before, I'm joined by my two friends, Christy Gupton and Carl Schusler. I know you're certainly aware of who they are. So yeah, welcome everybody. Let's do some quick intros. So as you know, if you're not aware of who Mitigate Partners are, we're 19 benefit consultants that come together. So we're going to skip and not spend a lot of time on that, but we collaborate, share ideas, local leadership that can take really great solutions that are brought from across the country in and help you build a better healthcare plan for your people to attract and retain the best talent. So with that said, I want to touch base quickly so everyone understands, because we talk about this frequently, right? This employer built versus insurer built or carrier built, whatever phrase you want to use. But this is what we see in Florida. So guys, correct me if I'm wrong, but the traditional healthcare plans that are put out there in the market are something that are built by the insurance company. You kind of get whatever they build. You get to pick a couple of things, but you don't necessarily get to pick how it works. And ultimately what they don't deliver is results. You get frustrated employees, you get higher and higher copays and deductibles every year, you get more and more narrow networks that don't necessarily deliver, and ultimately it's risen to a point where it's really frustrated a lot of people. When you look at what we do with the employer-built health plan, you have control over what happens. We completely deconstruct it and we build it for you. You don't have to figure it out on your own. We've got what we can refer to lovingly as the Fair Cost Health Plan. It's built for you, customized with all the transparency and all the high performance partners that we've built relationships with. And ultimately you get a healthcare plan that's human and employer and union centric plan. So it's built by you, you control it, you decide what happens, you get to decide who goes in the plan, and you control those costs. And ultimately what it ends up doing is retaining a ton of money for you to be able to utilize in the best way for your employees and for your organization. So the dividend that comes out of it's amazing. Now, you guys know we touched on this in our last rendition. The framework for the Fair Cost Health Plan has been put together for a long time. Carl's been utilizing it in a lot of cases. We're installing it in a few places around the country, in North Carolina with Christy, here in Florida for me. But we wanted to touch on one specific component today, which is cost and quality guidance and employee navigation, right? People get something that has to be done. They don't know where to turn. And so they reach out for different ideas. And so I wanted to put this idea in your head, like, what if you bought your healthcare the way we buy groceries? So let's take a moment and view this. And so you'll understand how our clients buy healthcare, but let's show you what the industry does first.
There are no prices on anything here.
Oh, believe me, some of it's pretty spendy. Whoa, that's really gone up.
Stop. I don't need both. Just one or the other. It depends on the price.
Oh, that's called shopping. We don't do that here. Thank you for coming in. Your bill? Your version will be mailed to you in 30 days. Good luck trying to make some sense of it.
Definitely, I think we all agree that healthcare's gotten a little spendy, like he says in the video. So from that standpoint, Christy, let me turn this over to you. And would you share with us some of what we've talked about from a Mitigate Partner standpoint? Like, what concerns do we have as an organization? What concerns are you seeing? So
one of the things that we always focus on is how opaque the status quo healthcare system is. We can't see into it. There's no transparency. Nobody knows what anything costs. What other sector of the economy operates that way? I mean, would we buy anything else without knowing the price up front? So why are we doing that with healthcare? We're also going to explore, how do you find the best doctor or provider? I mean, we've said it before. What do you call the guy or the gal who graduated last in their class of medical school? You call them doctor, right? And so how do you know that the doctor that you have found in your provider directory is the best one to be caring for you for the particular needs that you have? Let's talk about PPO networks, preferred provider organizations, and what kind of quality that there is in that. You know, a lot of people don't even realize that the credentialing process is really just a little bit of paperwork. And you don't really have any guarantee that the provider that you found in your directory has the kind of quality that you're looking for. Cost and quality issues, you know, you could have a higher quality service for a fraction of the price just waiting for you down the road. And how would you know that? Let's talk about navigation. I mean, how do I know what to do if I'm just an employee with an ID card in my pocket? So on the lack of transparency, you know, many carrier plans already do offer a transparency tool, but very few employees even use that because there's not enough incentives built into their plan to attract them to go and look for the right price. The Fair Cost Health Plan has those parameters set in place and tools that make that easy for everyone in the organization. Thinking about how network plan designs cover up the costs and you know, do employees really even understand what a charge master is? I mean, that is the sort of secret price list that nobody really knows about, and how do you get to that information? So when you're looking at a claim, do we pay $40,000? Do we pay $140,000 for the same procedure?
So Christy, you're also saying that the employees wouldn't know, and even if they use the provider tool, it's still not going to necessarily give them the information that's accurate, right?
Absolutely not. The carrier tool is only going to direct them to in-network care.
Okay.
So they really don't have a shot at finding the best.
And the other part too, Christy, is once they've hit their out-of-pocket max and deductible, they don't care.
Well, I've met my deductible for the year, so now how many more procedures can I rack up before the end of the plan year?
Well,
And
we're
so we
so
want to
trained.
try, yeah.
We're so trained that in-network is good. It's not necessarily good. The quality may not be in the network, right?
Many times it's not. And how would you know that unless you had a plan that featured the kinds of tools that the Fair Cost Health Plan does? So, you know, some people look at some information. Look at this. Some employee has gone on to like a neighborhood chat and is asking the internet, who does the best gallbladder surgery? Come on, folks. Do we really want the employees in your health plan searching, you know, the internet and just asking their neighborhood chat feature, who should I go to for someone to stick a knife to my skin and open me up? I mean,
Hey,
really.
Chrissy, that's somebody in my neighborhood that did that. That's my neighborhood, as you can see. I don't know.
So, I mean, that's not the way that we need to operate a health plan. No fiduciary would be able to put the stamp of approval on actions like that. We need data. We need proof that the providers that are getting our health plans money are the best ones out there. A couple of visuals that just show you the wheel of misfortune, right? You're throwing a dart against a board. The price is going to be. Let's talk about PPO networks too. I've often been known for saying that PPO networks are paramount to the ultimate participation trophy, right? You graduated from medical school, you've got an NPI number, and now if you could just fill out this paperwork, Dr. So-and-so, then you can become part of this network. Let's look at how do we get employees to go to the physician that has the lowest complications, the lowest mortality, the best outcomes. Look at this chart and see how, say, physician B, who has the best quality metrics, as opposed to physician I, you know, who might be just right down the street from you, but might have the worst quality scores. Employees just need help. They need steerage. They need their hands held. When you look with transparency and you look at the data and you see how the plan can intelligently spend the dollars so that we get the best care, that's really what we're aiming for. So someone in your plan has a heart attack. How do you know which facility in your area has the right quality line, that quality line that's sort of a yellow line? It starts out higher on the left-hand side of the screen and takes a dip going to the right. So we're ranking facilities in your area that based on quality, but then on their bill charges, what it costs them to do that procedure, and also what they usually get paid by Medicare, because that's a nice benchmark for us to be able to negotiate with. Carl, you're right in the Atlanta area. This picture is in your backyard. Why don't you talk about how we get employees to go to the right place?
Sure. Thanks, Christy. You have an employee that lives in South Atlanta. In this example, Atlanta is a big place, as you know, and a lot of traffic. Hospital A is that price. Hospital B is there. The real key is, how do we get the employee to go to hospital to the best value endoscopic center? And the whole problem is they don't know this. None of them have access to this, and they don't even know about it. And then if they do, how you gonna get them to drive there? And we'll talk about how you incentivize the plan design. But they're driving out there, they have no idea, and that's the challenge. And they're gonna go buy their house because it's convenient, and that's very costly to the plan. And as a point of reference, here's what Medicare pays. So it's interesting how these hospitals charge relative to Medicare. It's pretty substantial. Also, when it doesn't work, what do you do? And shopping's real hard with the tools that are out there that I think Christy did a good job of showing. The insurance company tools aren't accurate. What's your resources? Where do you go? You can't find anything out about anybody. You look you see how many stars the doctor got. That's not any good.
And can be doctored. You can pay to clean it up, right?
That's right. That's true. That's true.
So.
And we used this last time. This is really the biggest thing going on. I mean, the doctor can't take care of the patient because they're always looking through the third party's ear, whether it be a PBM program booking millions or whether it be an insurance company. It makes it hard for the doctor to take care of the employee. So we believe that we can protect your plan with navigation and steerage. The data is available. We got to get it in the hands of the employees. And that's what we try to do here with the Fair Cost Health Plan, is we put that data in the employee's hands so that it protects the plan. And you work with nurses that'll provide the guidance. And then again, we'll say over and over, plan design has to incentivize better decisions. And then you offer more employee education and rewards. Here's how it works. So we have a patient advocacy team that has nurses. An MD oversees it, but again, the employee calls in and they were routed to a nurse, and the nurse helps them find what's going on with them and get them to the best physician at the right time, and lastly, most importantly, the right quality. So as we go through that, this kind of sums up the craziness of American healthcare in one chart. These hospitals down in Dennis's neck of the woods, south of them, they're about 2,000 yards apart, and you can see with a heart attack with 4 stents and major complications, the spread difference between what they charge. It's amazing, 100% difference. So your employees don't know this. That's a real problem for your plan. They pick the wrong place, it's going to cost you. Remember, the employee only has a deductible and out-of-pocket max, and after that, they don't care. So this is about protecting your plan and the employee. So here's an example. It's down in Dennis's neck of the woods in Pinellas County, St. Petersburg, Florida. We looked at a knee replacement, and we looked at the physicians down there that did it. There were 60 that did it. Then we said we want to work with only physicians that do at least 50 or more procedures a year. That dropped us to 14. Then we looked at the quality, complications, readmit rates, etc., and it dropped it to 8. Then we looked at the cost of the implants that are put into the joint replacement, and 4 fell out of the funnel. So the question is, how is your employee going to pick 4 out of 60? And that's what this tool helps them do when they call in. The nurses will help point them and give them the 4. Then they take it a step further, where they'll even go in and they'll do an analysis with the doctors. And this particular physician had 4.47 deaths on the table. Now, I've been asked a couple of times, how do you have 0.47 deaths? My answer was, I think Christy Gupton cut the patient in half. I don't really know. But anyway, they're 4.47 deaths. I think I'd want to know about that doctor before I went to him, having knee replacement surgery. And then lastly, they look at the facilities. And again, you'll see here, the more someone does something, the lower the price. We covered up the hospitals on purpose not to reveal them, but one procedure is $161,000. They did 1 the entire year. The other one did 538. Look at the difference in the price.
I
So
think
again, price.
Yeah, let me stop you there, Carl, because this is something that comes up a lot. I asked actually somebody very sharp this week, and I said, hey, if it's 160 grand or it's 55 grand for the same knee replacement, where would you want to go? And I said, more importantly, where do you think your insurance carrier is going to send you? And they said, they're going to send me to the lowest one. I said, not necessarily and very much, probably not likely. And it certainly isn't the highest quality. We think because we spend more, we get higher quality. In healthcare, it doesn't work that way.
Right. Price equals quality. Most things in life, Dennis, not in healthcare. It's the inverse opposite.
I agree.
All right. And so in order to gauge employees, this is where the rubber hits the road. You have to incentivize your plan design. And so what we often do is we require our employees to call the nurse navigation service. If they don't call it and they're having a pre-certed or elective procedure and they do not call, they may face a penalty. It could vary from $500 to $1,000 depending on what the employer wants. That's a customized decision they can make. But the key is the employee has choices. So again, if Dennis doesn't like that Dr. Gupton's who they recommended, he'd rather go see Dr. Schuessler. Well, of course he would, you know. Why wouldn't you with this wonderful facial hair I have? Why would you not want to come see me? So the bottom line is Dennis can go and his plan pays like it's always paid before. It doesn't. Dennis' plan works just like it always has. But if he follows the advice advocacy team, his deductibles waived or maybe a copay applies. A lot of our plans don't have deductibles in the fair cost plan, but if it did, it can be waived. I promise you, employers out there, that employee will vote with their wallet every time, and they'll generally follow the advice of the advocacy team.
All right, so as we've said before, the cost of doing nothing on your health plan can be extremely expensive. So the first thing is you're going to increase the spend for you and for your employees almost every time. The second thing is going to be lower quality and higher cost and a slower return to work. So we want employees back to work as soon as we can. From an employer standpoint, they don't want to be sick and injured any longer than necessary. And ultimately, even though we talk a lot about costs, it is always about quality first. So we never want to sacrifice cost for quality. Nobody wants to discount eye surgery or knee replacement. So the missed opportunities to educate employees on future tools. So every time we implement one tool, we educate them on why they're invested in the plan and why they're involved in the plan is significant and important to us as an organization and important to their bottom line. Missing that improved opportunity for cash flow and the management for their business success, that's a big deal right now. Everybody's trying to make sure they have every penny in their business and in the market possible. And then the missed opportunities to gain that unfair advantage in the market against their competition. So if you like what you hear, we're going to ask you to do a couple things. One, reach out to us as Mitigate Partners. If you don't know what these things are, you don't understand what we talked about, or you just want more information because a piece of it sounded confusing, reach out to any one of us. We're across the country. We've got multiple people besides the few of us that you see here, but we're collaborating for the best ideas. And ultimately, we're trying to get content out to you on a regular basis to help educate you so you can learn a little more, do a little research, and then reach out for assistance when it's appropriate for you. The biggest message I'd say lately is don't wait till that last 60 days. This thing always surfaces right when you get the renewal, which is always at the last minute, which doesn't give you time to be proactive. Take a minute, have a conversation with somebody who can help you walk down this path and be proactive about it. Do it now because there's never a too soon to get started, right? So with that said, we want everybody to subscribe to the YouTube channel at Mitigate Partners, right, Carl? So that's out there. Anything that we missed, guys, before we jump off?
I think that people, employees have to know where to go. They have to be educated where to go. And every physician, every hospital is not the same. And there are hospitals that do better things than others. And there are some hospitals that do everything, but no one seems to do everything very well. So I think it's, again, the tool is so important to get them to the right place. It's better for the employee, and it's going to be better for the employer as well.
Thanks, Carl. And I'll just say, when I really saw the light bulb go on in a client's eyes, when I said, when the rubber meets the road, when employees really need healthcare, they don't necessarily want a directory full of choices. What they really want is their hands held through the process. So that really, I believe, sums it up for me.
Awesome. Well, thank you guys. I appreciate it as always. Subscribe to YouTube, come back for more. We'll be shooting more of these on some of the other tools as we progress through the months. If there's anything we can do for you, our information's right there. So thank you so much.
Bye, everyone.
See y'all.